I'm Mick from Edinburgh Napier University. Along with colleagues from the University of Edinburgh and the charity PCOS Relief, we're here today to discuss Polycystic Ovary Syndrome. We want to raise understanding and awareness of this common condition that affects so many women's health. Around 10% of women suffer from PCOS, making it the commonest hormonal condition to affect women during their reproductive years. Whilst it impacts upon fertility, its effects can be wider than this, and it needs to be better understood and recognised by us all. And that's not simply opinion, as there are published studies indicating gaps in education, early diagnosis and support, which collectively add to the burden felt by sufferers. My colleagues on this session are Professor Colin Duncan, a consultant in reproductive medicine and senior investigator at the University of Edinburgh, Kaur, the Chief Executive of the charity PCOS Relief, and Dr. Kasia Siemienowicz from Edinburgh Napier University, whose research career is based upon improving understanding of PCOS. I'd like to begin with a short animated presentation prepared by Colin and his colleagues to help us better understand what PCOS is and set the scene for discussion.
Dora, tell me what's been bothering you the most.
It's my periods. They've never been regular, but now I can go 4 or 5 months without one.
Okay. Anything else you've noticed?
My weight. I can't seem to shift it. I've always struggled with it, but it's getting worse. I'm also noticing that I need to remove the hair on my chin more often these days.
Let's talk a bit more about your periods. The womb is told to have periods by hormones from the ovary. These hormones are made when it grows and releases eggs. When the ovary doesn't grow and release eggs regularly, the periods are irregular. The ovary has to be told to grow and release eggs by signals from the brain. There are 3 main reasons why the ovary might not grow and release eggs regularly. First, the ovary might be running out of eggs, so can't respond to these signals. Second, the signals from the brain might be too low, so the ovary doesn't do anything. The third reason is by far the most common. The signals are there, but they're out of balance. This means that the ovary gets mixed messages and gets confused. It will start growing an egg, but not know what to do, so it pauses the egg, grows, pauses, grows, pauses, grows, and sometimes releases. When you have a scan of the ovaries, you see these little paused eggs, like dots on the ovary. In the past, we didn't know they were paused eggs and called them cysts, so it's known as Polycystic Ovary Syndrome. These paused eggs produce a little bit extra male-type hormones that can cause spots, skin changes, or extra hair. Dora has Polycystic Ovary Syndrome, or PCOS. PCOS can run in families, but we haven't found any genes that can fully explain it. It is likely that the tendency to have PCOS is in place before you're born. Symptoms of PCOS can become more obvious after weight gain. As well as a hormone imbalance, having PCOS means you're more likely to have metabolic imbalance. Metabolism is how our bodies process food. People with PCOS have a higher level of a storage hormone, which means the body is better at storing energy than using it. That can make weight gain more likely and weight loss more difficult.
Polycystic ovary syndrome is common. Around 1 in 10 women will have PCOS. The key features are polycystic ovaries on a scan, irregular periods, and evidence of increased male-type hormone. Not all people with PCOS will have the same symptoms. Although most have all 3 symptoms, just 2 is enough to make the diagnosis. That means that the diagnosis of PCOS does not always need a scan, and not all those with PCOS have irregular periods. A similar number of women will have polycystic ovaries on a scan, but no other features of PCOS. There is no cure for PCOS, and how we manage it depends on what the main problem is at the time. There are treatments available to help with periods, with skin and other problems, and with fertility. Weight management is important, as weight loss can improve PCOS by itself. There aren't good drugs targeting the metabolism imbalance at the moment, but some medications and food supplements may be useful in combination with diet and exercise.
I just want to highlight some of the key features about PCOS. There are no cysts on the ovary in polycystic ovary syndrome. The ovaries are not much bigger than normal size, and it's not associated with pain. The ovary is probably a victim of the environment that it finds itself in. Every now and then an egg will be released. That means a pregnancy may happen when you wish it to, but it also means that contraception is needed if you don't want to become pregnant. If you have PCOS and want to get pregnant, doctors are able to help with this.
PCOS is common, and seeking help from your GP will allow an accurate diagnosis to be made. You may be treated by your GP or referred to a specialist. A doctor will talk to you about the best way to manage your symptoms. Sometimes the internet can be misleading, but there are some very useful resources available. Take a look at the support and guidance offered by the PCOS charity Verity and the NHS Inform website for more information. This is one of a series of animations highlighting reproductive health issues produced by the MRC Centre for Reproductive Health at the University of Edinburgh.
I'd now like to introduce our first presenter today by handing over to Chand, who's going to discuss lived experience of PCOS and the role of the charity PCOS Relief. Chand.
I established PCOS Relief alongside my trustees after my own battle of being diagnosed with Polycystic Ovary Syndrome. This condition took 6 years for it to be diagnosed, and when being diagnosed, it to be described as I have light bulbs in my ovaries. With this in mind, I wanted to create a charity that would provide support and the right information to females when they would be diagnosed with this condition. So PCOS Relief focuses on the three main purposes: promoting health, education, and supporting members from the ethnic minority community. With this in mind, we wanted to provide services that would support an individual in their personal journey. And with that, we created weight management classes, diet nutrition classes, comfort talk, and a monthly steering group. With these services, we understand that they will provide the right support and information a female needs when she is being diagnosed with Polycystic Ovary Syndrome. PCOS Relief is currently supporting 2,500 females UK-wide. And with this, we are also providing support on a global scale in countries such as the UAE, India, and Saudi Arabia. I'll hand it over to Mick. Thank you.
Thanks for that, Chand. Thanks for sharing your experience and for the establishment of the support for others. I'd now like to turn the discussion to medicine with Colin for some further clinical insights into PCOS, its diagnosis and current treatments.
Thanks very much, Ray. So I see women with PCOS in my clinic. And the one thing that's very clear to me is that Polycystic Ovary Syndrome is a lifelong condition. It's something that you're born with and you're always going to have to one degree or another. And what we do depends on which stage of the life you're at. Because obviously in the early years, it's about education, it's about diagnosis. In the reproductive years, it's a lot about fertility and menstrual health. And then later, it's a lot more about screening, prevention, and treatment of any form of chronic disease that's associated with Polycystic Ovary Syndrome. Now, we know that Polycystic Ovary Syndrome is a hormone imbalance. Now, how does that manifest itself? Well, one way is a reduction in fertility. Another way is irregular periods, or periods that can be very heavy and go on for a very long time. And another way is affecting the skin with perhaps some extra hair or spots or acne. Now, when it comes down to managing these conditions, we're actually really good at managing fertility. We've got medication that will make the ovaries grow and release eggs normally. We're actually pretty good at managing the abnormal periods. We can help with the skin, but we don't have quite as many tools in our box to be able to fully get perfectly satisfactory results. But remember, there's that metabolic imbalance. And that metabolic imbalance manifests by making women more likely to get type 2 diabetes in later life, or perhaps gestational diabetes during pregnancy. There's also increased fats in the blood, which can affect the liver and increase the risk of cardiovascular disease. And then there's weight. There's a link with PCOS to obesity. Now, when it comes down to managing diabetes, it's something that we can help with. When it comes down to managing the fats in the blood, there's things that we can do. When it comes down to managing the weight problems associated with polycystic ovary syndrome, we're not very good at that. And when I see patients in the clinic, weight is a really big issue for them. And actually, sometimes that weight can preclude the management of fertility because there are some weight limits on fertility treatment. So let's think a little bit about weight in polycystic ovary syndrome. Now, when you gain weight, it's either because you're taking in too much or burning off too little. Now, if you look at women with polycystic ovary syndrome, there doesn't seem to be any evidence that they eat more than anybody else. So let's look a little bit more about burning off calories. So the energy you expend by physical activity is only really 25% of the energy you expend. Now, 60% of the energy you expend is just by staying alive, your heart beating, your brain thinking, your body working. And that leaves 15%. And that 15% is something called adaptive energy expenditure. And adaptive energy expenditure allows you to burn off calories that you don't need. The reason that this person's in flames is because after you eat, your temperature goes up, and that allows you to burn off calories that you don't need. So you might notice after a really big meal that you feel hot and sweaty, and that's your body just burning off some of these calories that are not needed. Now, if you look at what happens in polycystic ovary syndrome, women can only burn off 75% or 3/4 of the calories that somebody without polycystic ovary syndrome would be able to burn off after eating. What does that mean? It means there's a gap. It's not a level playing field. It means you have to either eat 4% less every single day to be the same as anybody else, or exercise 20% more. Now, sometimes women can do that and achieve a normal weight. But if you don't, and if you don't be on that diet and physical activity all the time, the weight will gradually creep up. And that's associated with the weight problems. And we know that as you gain weight, polycystic ovary syndrome gets worse. So there's a real unmet need for understanding more about how we can manage weight problems in polycystic ovary syndrome. So I'm going to pass back over to yourself there, Mick.
Thanks, Colin. And I think that leads us very nicely to the scientific research that Kasia is busy with and how this is actually helping shed light on this problem of weight gain in PCOS. Kasia.
Thank you, Mick. So I would like to give you a very brief overview of our recent PCOS research. So as mentioned already today, PCOS is one of the most common endocrine disorders affecting up to 10% of women. The main characteristic of PCOS is increased level of male-type hormones, androgens, including during pregnancy. So as Colin said, women with PCOS have irregular periods and difficulty in getting pregnant. But they also have an array of metabolic problems, including insulin resistance, type 2 diabetes, abnormal blood lipids, or increased fat accumulation in the liver. But the major concern that particularly bothers women with PCOS is the difficulty in maintaining a healthy weight, as up to 80% of women with PCOS are overweight or obese. Now, the problem is that obesity makes all the features of PCOS much worse, including the reproductive ones, and weight loss improves PCOS. But the issue is that women with PCOS find losing weight incredibly difficult. We still don't fully understand what causes PCOS, but there is increasing evidence that elevated maternal androgens may play a role. So we have developed a sheep model of PCOS, where we expose pregnant sheep to increased levels of androgens, and then we study their offspring. Those offspring develop PCOS, and importantly, allow us to study mechanisms underlying reproductive and metabolic problems associated with PCOS. So one of our main research focus is obesity and PCOS. As Colin has already mentioned, obesity results from increased energy intake and decreased energy expenditure. We know from research of others that there is no evidence of increased energy consumption or decreased physical activity in women with PCOS. So what about this postprandial thermogenesis, this energy which is burned after eating? Professor Steve Franks demonstrated that indeed women with PCOS burn less energy after eating when compared to control women. We wanted to know if androgens could play a role in that. So we studied our PCOS sheep. And indeed, we found that those PCOS sheep had also decreased postprandial thermogenesis, just like women with PCOS, and they also became obese in adulthood. We have also demonstrated that this decreased postprandial thermogenesis likely results from reduced insulin signaling in the brain. That means if we can increase insulin in the brain, we can improve postprandial thermogenesis. So we have tried that, and we have demonstrated that simple insulin nasal spray can normalize energy expenditure in PCOS sheep. So what is the next step? There is more good news. We have received money to try this in women with PCOS. We are currently running a trial of insulin nasal spray in obese women with and without PCOS, and we should have our first results very soon. If the trial is successful, we'll be able to help millions of women using a cheap and widely available drug. Our research has also focused on the role of fat tissue in the metabolic problems associated with PCOS, as there is increasing evidence that adipose tissue, so fat tissue, might be dysfunctional in PCOS. Why should we worry about fat? Well, fat is an incredibly important endocrine organ, regulating many aspects of metabolism and overall health. The problem is that if you don't have enough subcutaneous fat, so this fat underneath your skin, the extra energy will be stored in visceral fat, so this unhealthy fat around your organs or in your liver, muscle, or pancreas. And this, in turn, will lead to other metabolic problems. So we have discovered that during puberty, our PCOS sheep have dysfunctional subcutaneous fat, which leads to fat accumulation in other organs and several metabolic issues during their adulthood. So what, you may ask? Well, we believe that if we can intervene early, we can fix this dysfunctional fat problem during puberty, and we'll be able to mitigate lots of downstream metabolic problems in PCOS. And this is where we're going next with our project. So in summary, our research is trying to shed light on problems associated with PCOS, especially metabolic problems, and we are determined to develop new therapeutic approaches to combat those problems. So the research is a collaborative effort, and I would not be having this opportunity to share our research findings if not for those 4 amazing scientists listed here. So finally, I would like to thank you all for listening. I hope this short presentation has clarified what PCOS is and how it can be managed. If you would like further information, please follow links to NHS Inform and PCOS Relief. Before we go, I would like to end with some words from Professor Mick from Edinburgh Napier University, who has kindly organised this event and podcast. Thank you.
Thanks, Kasia. It's great to see research specifically targeting issues that really affect PCOS sufferers. And as Kasia said, if you would like further information, then please do follow the links to both NHS Inform and PCOS Relief shown below. Edinburgh Napier University's Centre for Biomedicine and Global Health is a multidisciplinary group of scientists who conduct research focused upon understanding the origins and causes of diseases. We're very grateful to PCOS Relief and the University of Edinburgh's Centre for Reproductive Health, and hope that this presentation has been useful in explaining a little bit more about polycystic ovary syndrome. Thank you.